Hello, good morning, everybody from Kisumu, Kenya, East Africa. I've been speaking for a minute now. I've just realized that my audio was muted. If you can hear me, kindly just say yes. Just let me know if you can hear me.
Yes, we can hear you.
All right, thank you.
Owaga should mute.
Yes. Mr. Owaga Vic should kindly mute your audio. We can hear your background noise. Owaga Vic, kindly mute your audio. We can hear you. Can hear your background sound. We'd like to just have us speak in an orderly way, like when the speaker's turn is to speak, we will only listen to the speaker, and then we'll have a plenary session where we are going to have questions and answers. So at that point, we'll make it open for as many of us as possible to share, but still it will be organized. So thank you so much. This Zoom meeting is going to last an hour. So exactly 10 to 11, we are done. My name is Winnie Wadera. I am part of the RHAY Africa Secretariat in Kisumu, Kenya, East Africa. So thank you so much for making time to join us today in our STI, what we call our STI festival. It's really SRH festival, but today, because of the theme of the day, we are going to be tackling all things STI. So we have our doctor with us, who is going to be the expert for the session, who's going to take us through all things STI as much as we can capture within the 1 hour period, but it's not entirely 1 hour. It's just probably a few minutes, and then we take questions and then respond to those as well. So for people who are coming across us for the first time, I would just like to give background information on who RHAY is and what we do and where we are at, and all that. So RHAY Africa is a movement meant to bring together adolescents and young people from East and Southern African countries towards making creative interventions or health contributions towards HIV prevention, care, and treatment. So we have our motto, which is nothing for us without us, nothing for adolescents and young people without adolescents and young people. And in this case, we are talking about HIV and AIDS. And other than that, we are also including other sexual reproductive health information. So we are saying young people deserve and can be meaningfully engaged right in the middle of coming up with interventions around their sexual reproductive health. So for so many years, we have been in existence, 5 years to be precise. And one of the things that really got us to this point today is we were able to conduct an international East and Southern African countries conference on HIV. And from there, young people mentioned that they don't want this engagement to be a one-off exercise, that we want it to be continuous. And so that's why we moved it from a conference or from a one-off mentorship activity to now a movement, where now we are going to be consistently engaging adolescents and young people around HIV and other sexual reproductive health components. So earlier this year, we set up a survey to find out how young people like to be reached with information on sexual reproductive health, and what are some of their areas of interest, and how can young people be accessed with the information. And it became very clear that young people can be or are interested in being accessed through social media, specifically Facebook. We have a survey. That means we have like real data around this information. So most young people prefer to be reached virtually and on social media and on Facebook and other platforms. Facebook, I keep saying Facebook because it topped the list. And so we are trying to ensure that we maximize sharing information through these platforms. And that's why with the first activity is this one, where we are reaching out to adolescents and young people in East and Southern African countries through this virtual platform. So we are starting with Zoom. And then after this, we are going to record the session and have the session on all our social media platforms. So we are talking TikTok. You can find RHAY Africa on TikTok. You can find RHAY Africa on Instagram. You can find RHAY Africa on Facebook and on Twitter. And we keep growing. So wherever young people are going to be, we are fluid. We are able to disappear. I do not. I'm sorry, guys, I disappeared. I don't know why. Maybe my internet is not stable. I apologize for that. but it's good that we keep recording, so we didn't lose this. Yeah, so that is a bit of background information about RHAY for those who are engaging with us for the first time. We've had an international conference. We also have a mentorship session that has been funded by Bill and Melinda Gates Foundation. So in this mentorship session, we were working, and we still are working with adolescents and young people who are interested in research. Let me just work on my internet before this disappears again. Let me go here. So we were supported by Bill and Melinda Gates Foundation to identify adolescents and young people from East and Southern Africa who have innovative ideas around HIV prevention, care, and treatment, to mentor them through that, through developing their research ideas. So from just abstracts, elementary concepts, to mentoring them through writing protocols, to getting supporting them to get approvals in the various countries to be able to conduct research, to now implementation. And that is something that we have done, you know, with 30 adolescents and young people under the age of 30. That's why our mentorship award session is called 30 Under 30 Award. So that is a very specific component under RHAY Africa, which purely targets adolescents and people's involvement in research on HIV. I think one of the Zoom engagements will also just try to understand what is the 30 Under 30 Awards and how does it work, and how, if as a young person you'd be interested, how can you participate. But for today, like I mentioned, is we are targeting, you know, just learn around STIs. We have an expert with us, and without further ado, I would like to, you know, maximize on time by handing over the session to Dr. Ayeko. Dr. Ayeko is an expert in STIs.
Oh.
And so, Doctor, at this point, I'll invite you to come and share with us. So you can keep it as graphic, as ethically accepted. And then after that, guys, we are going to get into a session of questions and answers. So if there's something that crosses your mind during the presentation, please just keep it on the chat box. Just type it in the chat box. I'll be noting them down, and then I'll be raising them with our good doctor to respond to that. So before our good doctor comes to share with us, I want to make a request for everybody to have their audio on mute. Kindly, everybody have your audio on mute so that we give Dr. Ayeko ample time to take us through his presentation on STIs. Karibu sana, Daktari. Thank you, guys.
Thank you, Winnie. I'm Bernard Ayeko. Maybe the other participants could mute, please. I'm not seeing the mute, so that you can make it well. Nancy Acheng, Kias, please mute. So I'm Bernard Ayeko, as Winnie said. I'm going to present on sexually transmitted infections. I'm going to share my video. My slides, sorry. Can you see my slides? Hello?
Yes.
Can you hear me?
Yes, we can see the slides and hear you very well.
Okay, good. Thank you very much. So welcome to the Sexual Reproductive Health Festival. I'm going to measure on sexually transmitted infections. So in case you have any questions, please just write it down. Then we're going to share at the end of it, as the Winnie had said. So I'll present my outline so that we know what we're going to talk about. Review the male reproductive system together with the female bit. Of course, I know we know this. Then I'll talk about definition of terms, some free terms. Then we look at the common sexually transmitted infections that we usually see. Then we look at how STIs present, then how to identify the STIs in case one has it. And then we look at the prevention and control measures at the end. Somebody, could you move, please? Somebody's really talking in the background. Hello, could you mute? We look at the internal male reproductive health organs. I know you know this diagram. We have this is what we're going to talk about on males. So the conditions affect these organs. So I know you know these parts. So just a flash and review. The female reproductive health organs. You know those parts. This is just from biology and what we have learned previously. So these are the areas, these are the parts that we're going to talk about, which are affected by the sexually transmitted infections. This is for the male, this is for the female. Then we're going to look at what really is sexually transmitted infections. This has been a question in our minds. Most people really don't understand, don't know what they are, because a few know. And we look at a few definitions. The terms like STD is a very common term. We look at another term called STI, another term. Most people confuse STD and STI. We look at the RHAY, right? So STD, that is sexual transmitted diseases, is a term used when the infection is in the clinical stage. When you can see the symptoms of the disease, then you call it sexually transmitted diseases. Then STI really is the term that was introduced to include the preclinical stage. That is the stage where you can't see the symptoms. You have the disease, but the symptoms are not there. So these ones were included. That's why we call it sexually transmitted infections, because infections are in there, but the symptoms are still not yet out. We have the RTI, this is reproductive tract infections. This refers to all infections of the reproductive tract. Most, but not all of them are sexually transmitted. So these are terms that we commonly talk about, but I'll major on STIs. Today's presentation, I'll major on sexually transmitted infections. That is the conditions that we see, the symptoms, and those ones that are symptoms are still not yet out, or symptoms, we call it asymptomatic. So some of the common STIs present with urethral discharges. Some present with lower abdominal pain, especially for ladies. And some present with ulcers around the genitals. And some present with abnormal vaginal discharge. Of course, we have normal vaginal discharge, but the STIs present with abnormal vaginal discharges. Then finally, some of them present with discharge from the eyes, especially for the newborns. So these are the common STIs that I'm going to talk about today in this festival. So STIs present, I'm going to start with those ones that present with ulcers, urethral discharges and low abdominal pain. Some of the pictures I'm going to show are a bit graphic. So I don't know whether you'll be comfortable that I show the pictures.
Yes, I'm comfortable.
Yes.
Members?
Yeah, show the pictures.
I go
are
out and show the pictures?
Yes, we need to see them.
Okay, so some of them look like, for example, we have the urethral discharges. These are some of the pictures. This is a male organ with a pus-like discharge. You can see the pictures well. And this is gonorrhea. Usually, you find a person has frequent urination. He goes to the toilet frequently. And while passing urine, there's pain on passing urine. And then you have this discharge that you can see. And then sometimes if it is not treated in time, then the infection goes to the testicles and the tubes there. Then we have pain on the swollen testis. And usually this appears past 1 day to 14 days after sex. If you have sex with somebody who had gonorrhea, then you start having these symptoms during the first day you have the sex activity, and also the 14 days. So it's between 1 day to 2 weeks. You start feeling this or seeing this. Another condition that also presents with a discharge is chlamydia. Chlamydia's discharge really is not much, it's scanty, and usually is cloudy and watery. They also present with painful urination, and it also presents with a painful testicles if the infection goes to the testes. For chlamydia, the infection appears between the first day and 21 days after exposure, after you've had sex with a person who has the bacteria or infection. This is the picture. The first picture on your left, that is inside of the vagina. It has been opened up with a speculum. You can see inside the pus, inside the cavity. And the one on the right, that is the cervix. At the end, far end, you can see pus at the entrance of the cervix. That is the entrance of the uterus. Usually, it presents mostly in women. Gonorrhea is sometimes there's no symptoms because the infection is inside the wall of the vagina and the cervix up there. So it can take some time before you have the symptoms. But for men, it's faster because the infection is in the urethra where they pass urine. You know, the women are passing urine through the other side. The urethra is different from the vagina. So when the infection is in the vagina, you might not feel pain. So it might take even sometimes even 3 months, even 2 months before you start feeling anything. So when the infection advances, you'll have vaginal discharge and also pain or urination if the infection goes to the urethra. And also sometimes if it complicates, you develop lower abdominal pain when the infection has gone up to the pelvic organs like the uterus, to the fallopian tubes, the ovaries, then you develop abdominal pain. This usually appears after 2 weeks of exposure. If you have sex with a man who had gonorrhea, then it can take him 2 weeks before feeling anything, or it can even take much more time. Yeah. So for women, the pain usually takes longer. So that's why when your man says that he has been diagnosed with gonorrhea or chlamydia and is on treatment, and he tells you to go for treatment, it's better that the lady also goes because the pain in women takes longer compared to the one in men. So this is for both gonorrhea, chlamydia. So we have vaginal discharge that is pus-like, right? We have the same gonorrhea can present in newborn babies. The lady, that's why we always advise all women when they are pregnant to go for antenatal clinics. Because if you don't go to the antenatal clinic, at the antenatal clinic, they'll check you for urine and all that. And if they diagnose gonorrhea early enough, they put you on treatment so that when the baby is born, it doesn't. Discharge usually comes 30 days after birth, when the infection has already really infected the eyes and the eye is discharging pus. So if you see this in a newborn baby who is 30 days or below of life, then it's likely that this baby is having gonorrhea of the eyes. And medically, we call it ophthalmic neutropathy. And that is it. So we also have fungal infections that affect both male and female. In male, the glands, that's the head of the penis, and the inside of the foreskin, if you're not circumcised, is inflamed and swollen, as you can see on the right. And in the vagina, you'll see curdy discharge, some white, looking like milk discharge. So for the males, you'll find the head of the penis is swollen and very painful. And for women, you find itching. There's a lot of itching in the vagina or the lips. And when you have sex, there's a lot of pain in having sex. And there's redness and swollen vulva with a thick white discharge, as you can see. Sometimes you might see some watery vaginal discharge. This is fungal infection. We call it candidiasis. Usually, The fungal infection is an infection caused by a yeast. It's some sort of a fungus. We call it Candida albicans. And normally it lives, this fungus lives on the skin, the normal, and inside the body, such as the mouth, we find the Candida albicans in the mouth, the throat, the gut, vagina, without causing any other problem. Usually they are normal commensals there. They don't cause any disease. So Candida can cause an infection if conditions change inside the vagina to encourage its growth. And some people ask, is fungal infection or can just an STI? Of course, genital fungal infection is not an STI. It causes swelling of the vagina, we call vaginitis, and other sexually transmitted infections can also cause vaginitis, of course. But Candida albicans is a fungal infection. It is not an STI. So we should not confuse discharge from the vagina, that is like clotted milk, this itchiness, and this one is not an STI. Other sexually transmitted infection, of course, like trichomonas, chlamydia, gonorrhea, herpes, can also cause the swelling of the inside of the vagina, that is called vaginitis, just like that. So that's why it is important to go for checkup. If you have such condition, if you have anything in your privates, you need to go for checkup so that you can differentiate between candidiasis and other STIs. It's important. So the risk of fungal infection is when somebody uses antibiotics to treat other infection, somebody can, have fungal infection if you overuse the antibiotics, because antibiotics kills bacteria. They are actually good bacteria in our systems, like the vagina or all those, as I said earlier. So if you use antibiotics, you're going to kill other bacteria, even those ones that are good. So these bacteria keeps the yeast in check within the vagina. So the balance sheet between the good bacteria, if you kill them overusing antibiotics, you'll end up there. So if sometimes if you have diseases like HIV, your medication can also suppress the immune system that is already suppressed. And then you predispose yourself for getting fungal infection. So chemotherapy, those who are on chemo and radiation therapy or treatment, like cancer, can also suppress immune systems, then changing the environment within the vagina, then making the fungus flare up. Pregnancy, anything that disrupts or changes your hormones can disrupt the balance of Candida in your vagina. Then this is also common. Fungal infection, vaginal fungal infection is also common in pregnancy. Even those ones who are using birth control pills, birth control pills are hormones, and pregnancy also comes with its hormones. So this can change the environment within the vagina. So this can also predispose one to fungal infection. High blood sugar also impact on bacteria in the vaginal environment, that if the sugar is not controlled well, you find these people having fungal infection. So these are factors that predispose people into getting fungal infection. Of course, also the other factor is when sometimes you wash inside your vagina with soap. Soap is a disinfectant to kill the bacteria there that are supposed to be there. So you're also washing the good bacteria out. So usually we say that the vagina should not be washed. It washes itself. So preventing the fungal infection, what we say, we advise that avoid using any scent diffusers or around the vaginal area, or we also discourage vaginal douching. Douching is washing inside, flushing inside the vagina so that you feel clean. By the way, the more you wash it, the more dirty it becomes. Also, scented tampons sometimes also interfere with the environment within the vaginal area, so predisposing one to fungal infection. So we advise that women should keep themselves clean and dry all the times. We advise that they wear cotton underwears that want to irritate their skin and there, because underwear absorbs sweat, place remains. We also advise that people refrain from wearing very tight trousers and jeans. I know this is fashion, but it also predisposes people to, fungal infection. So we also advise that women practice quality personal hygiene and relax. Avoid stress, because stress lowers your immunity and then brings up other things like fungal infection. So if you practice these 6 STL. Remember, I said one of them. Stretchy, they're like mucus, they're white. So these ones are normal vaginal discharges. Actually, those ones with their periods, normal periods, you find these discharges. Usually the first day of your bleeding, we call it day 1 of your period. And then most ladies bleed for 3 to 4 days, and sometimes can take 7 days. Then after the 7th day, the blood stops and you start having a period of wetness, feel dry a bit, then wetness. Then as you approach day 14, you become more wet. And at day 14, we have clear vaginal discharge. That is like mucus. That is normal. That is not an STI. So after 14 days, you start becoming dry again. And day 21, the wetness is, dries up. And day 28, you bleed again. So this is because of the hormones that we have. The first half of your period, the lining of the uterus is built by the production of estrogen that are produced from the growing follicles in the ovaries. And the second half is controlled by progesterone that are produced from the follicle that has released the egg. We call it corpus luteum. So as the progesterone increases, then the dryness also increases up to day 28. This is for regular menses. Usually we have around day 14, we have clear physiological discharge, which is normal. So if you have discharge around day 14, it is clear, it's white, it is viscous, like mucus, you are not sick, you are very normal. That is normal physiology. So don't you worry. So I come again to STIs that present with genital ulcers. Okay. So I'm now presenting those ones that present with ulcers. And this is called chancroid. The one on the left is on a male organ. It has been eaten up by chancroid. If you look at the upper part, at the groin, that's where the wound rests. So there's going to be another wound there. So this chancroid eats up this penis if it's not treated in time. On the left side, we have a wound on the labia, on the lip. One of the lips is being eaten up by chancroid. Usually chancroid has a dirty base, the rugged edges. Yeah, presentation is small. Usually it starts with a small bump. 1 to 2 weeks after exposure, after you've had sex with somebody with chancroid. And 1 or more, these wounds are very painful. The ulcers are very painful. The chancroid ulcers are painful. So within a day, so these leaks pass. And we have the bacteria that causes chancroid coming from the pus, the wound. And it bleeds easily when scrubbed. Please mute. Veronica, can you mute, please?
Yes.
Veronica, mute. Mute. So this bleeding, it